Thanks, ladies and gentlemen, for joining us in this edition of the Primetime Newscast on Equinoxe Television, live from our headquarters in Cameroon's economic capital, Douala. The wearing of face masks against the coronavirus becomes obligatory in the southwest region of the Republic of Cameroon. This is a decision of the southwest governor, Benau Kalebilai, as Cameroonian authorities step up the fight against coronavirus, taking other stringent measures to curb or limit the spread of the coronavirus in the Republic of Cameroon. Stay with us. Thanks, dear viewers, for joining us on this edition of the news on Equinoxe Television. We'll begin with news streaming into our studios from the far north region of the Republic of Cameroon, where at least 7 persons are reported to have been killed by militants of the Nigerian terrorist sector Boko Haram in their last attack over the weekend in the locality of Amchidi. At least 15 persons were equally wounded in that attack by militants of the Nigerian terrorist sect in Amchidi, far north region of the Republic of Cameroon. Now, in news concerning the coronavirus pandemic, the figures of confirmed cases and deaths continue rising in the Republic of Cameroon. Close to 700 confirmed cases are now reported, and at least 9 persons have died of the COVID-19 in Cameroon. And the government of the Republic of Cameroon is stepping up its fight against COVID-19, taking stringent measures to curb the spread of the virus across the Republic of Cameroon. But some observers of the civil society and political leaders are saying that more stringent measures have to be taken, but some considerations must be taken into, some issues must be taken into consideration in some actions that the government will take. And we spoke to a US-based medical expert, and Smanjikan Gabriel compiled her views in this report. Smart Njikan Gabriel with the report on the views of a Cameroonian US-based medical expert on the fight against COVID-19. And among other things, she discourages self-medication and the use of chloroquine that could cause other health complications in the system of the users, according to the Cameroonian United States-based medical experts. And she talks about other issues concerning the management of COVID-19 in Cameroon compared to what is being done in the United States of America. Smanjik and Gabriel.
The United States of America as well as Cameroon are in the battlefront. Both are faced with the struggle to conquer COVID-19 that has caused enormous trouble to its population. A Cameroonian US-based doctor says America could, in the days ahead, witness a drop in the numbers of patients because of the confinement policy implemented, but she says that can be possible in Cameroon. The staying at home order that we have in the USA in Western countries cannot really be implemented in African countries because we just don't have the same structure, the same reality. You cannot ask people to stay at home under a temperature of 40 degrees with no water and no electricity. According to her, the best solution for Cameroonians to stop the spread of the disease is through the use of face masks. What we can actually do is to give some masks to all Cameroonians. This is the only way we can contain the spreading. This number is going to increase, and it's going to increase dramatically if we don't find another way to prevent the transmission. And so far, just having a mask can decrease your risk to spread the disease, but only to be infected. So I'm going to really encourage Cameroonians to wear a mask. She also warns a lot about the use of chloroquine by Cameroonians. Chloroquine will never protect you or prevent you from being infected by the disease. No, you are going to just cause another problem.
You don't know how it will act in your liver. You don't know if the chloroquine that you bought outside on the street is the really chloroquine and what is the toxicity. So I really encourage you to stop doing the automedication.
The Cameroonian US-based doctor has this advice for the government in relation to the circulation of chloroquine.
Government in Cameroon should really find a way just to forbid or restrict the availability of chloroquine just to the hospital, especially if chloroquine is not used anymore to treat malaria. So I don't see why we should have them in pharmacy store, because even if we say that from now, if anyone needs to have a chloroquine, that person needs to have a prescription. People might find a way to come with fake prescription and still buy the chloroquine. So we want to avoid that. So I really think that it should be solely restricted to hospital.
Cameroon, at the time of this report, is counting 658 patients with COVID-19 virus.
And on the issue of total confinement, total or partial confinement, which is on the table of the Cameroon government, medical expert Dr. Ndifo Peter Louis, Secretary General of the Cameroon Medical Council, says that it's going to be difficult to implement total confinement in Cameroon because of some socio-cultural hindrance that will not be favorable for the implementation of total confinement in Cameroon. He, however, proposes other solutions that the Cameroon government can implement to stop the spread of COVID-19 in the country. Take a listen.
You know, our people in Cameroon, with the indiscipline that we have, with the financial difficulties that we have, can we be able to be self-confined? Can we be able to stay at our homes without even moving out? That is a big difficulty. Self-confinement, we think it's a very big problem and will not be recommended for in Cameroon. The South Korea and German model, in which they do identification of suspected cases, they do mass testing of those who are suspected, and they actually make sure that they close down all the social places, and they make sure that those who are vulnerable and who are sick are actually admitted into hospitals and quarantined. Those who are actually suspected cases are actually quarantined. For example, in South Korea, they have geolocalization. It means that they could be able to tell where a suspected case is. If at all you leave the area, they can be able to tell you whether you have left that area or not. But if you realize, this method was very, very successful in South Korea and in Germany. And so that is one of the recommendations that we may be able to have in Cameroon. And then the most famous one, the Maxer model from Professor Didier Raoult, which takes into consideration the South Korea and the German model and adds in massive screening of the population. Massive screening of the population and treatment of all positive cases. It has been shown that hydrochloroquine and azithromycin have significant effects on the coronavirus. And he carried out a study, and out of all his patients that he took care of, only one patient died.
Dr. Ndifo Peter Louis, Secretary General of the Cameroon Medical Council, also thinks that government should invest more in tracking all suspected COVID-19 cases or all persons who are suspected to have come in contact with confirmed cases of coronavirus, and that government should also invest more in equipping hospitals and medical centers or health centers across the country for a proper management of possible cases of COVID-19. Listen to him.
One of the basic things that Cameroon has not done is that we've not followed up on all the lost quarantine cases that came from the flights on March 17th. So what we should be able to do, we should be able to put our intelligence officers, the police, the armies, to be able to track all of those passengers that arrived with this flight, because we know that they are the origin of this infection in Cameroon. If you track these passengers and you get their contacts
and their relatives, persons
everywhere that they have, everybody that I've contacted, then we actually do testing for all of them, and we quarantine them. It's an obligation. It's not a matter of option, because it's a matter of national danger, and the people should be well educated that this is something to be able to protect the society. I think if we track those people who actually were the initial vectors of the infection in Cameroon and get their contacts and do improved testing. Apart from that, we look at the health infrastructure. You talked about it before. How prepared are we? Health facilities have difficulties to be able to protect health personnel. Health facilities have a significant difficulty to be able to take care of corona patients.
Wearing of face mask as part of the measures to fight against COVID-19 has become obligatory in the southwest region of the Republic of Cameroon. The southwest governor, Benau Bilai, has decided that all persons visiting public institutions must put on a face mask or will not be granted access. The southwest regional administrative officials are stepping up the fight against COVID-19, as our correspondent Derek Jato reports.
Please open 1 meter. Please open.
The awareness is everywhere, and the affected are among us and unknown. Coronavirus is real.
It is no longer something to tell. Most of the families have been victims or are to be victims. Let us stop it through our behavior, through the collaboration for implementing the 13 measures.
Seen more now on the field than in meetings, Governor Bernardo Bilai is heading to the Mongo Bridge, where the southwest region separates with the littoral. Preventive measures must be seen in practice here before any person gets into his region, the southwest region. And among other things, the southwest governor stressed on the use of face masks, and that should start here at this entry point.
The Minister of Public Health has recommended to the population to wear a mask when they are going out. That's why we went to the bridge. We set up a sensitization control chip to sensitize the population, particularly the passengers. They should wear the mask and they should pass through the screen to verify their temperatures. We want to plead with all the passengers, all the population to collaborate. It is not to bother them or to harass them, just to sensitize them and help them.
And it is an obligation for those in public services or those who are to visit such establishments.
We have also decided that as from Monday, those who will go to the public services should wear a mask.
The southwest region is yet to fully practice the preventive point of social distancing, as markets, for instance, are still very congested. But Chief Mayor Mososo Peter Ekome II, the mayor of the Tiku Council, told the Southwest Governor that it is a continuous battle and his municipality is not relenting.
Tiku municipality has started doing that already. Now with the force of this regional campaign team, like I said, we have to only intensify the rules, not gathering people more than 50 in a place. We talk about you preserving yourself from not attending occasions that look crowded. It is for our own benefit, for our own betterment.
it is the wish of the Southwest people to see the number of confirmed cases that are steadily rising to start falling.
The Douala City Mayor has taken a similar measure. Roger Mbassa-Dini has decided that the wearing of face mask to fight against COVID-19 will be obligatory in the days ahead in the town of Douala. And one of the groups of persons described as most vulnerable as far as the COVID-19 pandemic is concerned is made up of internally displaced persons who have been kicked out of their homes by violence in Anglophone Cameroon, and they are now seeking refuge in other parts of Francophone Cameroon in very difficult and deplorable conditions, which further exposes them to the risk of contracting COVID-19. And some of them were visited over the weekend by officials of the Popular Action Party. Details with Immaculate Fagui.
They ran away from gun battles, killings, destruction of properties and other atrocities committed in the northwest and southwest regions to seek refuge in other regions of the country. And today, another war stares them right on the face. They are internally displaced persons. Amidst the growing coronavirus pandemic, their difficult conditions put them more at risk of being infected by the virus. And this is why persons displaced by the Anglophone crisis have been described by members of the Popular Action Party as the most vulnerable.
You realize that internally displaced are the most psychologically touched. You know, they just left a zone where there was already an existing crisis. They ran from that crisis, which has to do what called the Anglophone crisis or called the Anglophone war. They ran from there for safety. And most of them are very vulnerable. They live in, majority of them live in houses.
Officials of the Popular Action Party visited some of these internally displaced persons in the Douala 5 subdivision. During their visit, they offered these IDPs hand sanitizers, face masks and financial assistance.
So it's a way to empower them financially, to sensitize them and to tell them the dangers surrounding this pandemic, because to some of them will have the notion that what we already saw in where we left is even worse than what we are seeing here, so we give a damn to so it is in that light that we deem it necessary that we need to meet with the IDPs.
I'm called Bisong Rosemary, an IDP here in Bonaberi, Douala. Just wish to thank the team that has come to really sensitize us about what is going on in our country now, the coronavirus. So I just wish to thank them for the hand sterilizer and the face masks that they have given to us, because really now life is not really easy. So with this, we were looking for money to buy this, but now that they have given to us, it will help us what we are having to manage with our family, with our dear ones.
The measure, according to the officials of the party, is meant to mitigate the impact of the fight against the deadly coronavirus.
Some of the hundreds of thousands of Anglophone Cameroonians forced out of their homes by the Anglophone crisis in Bonaberi in the Douala 4 subdivision receiving health talk from members of the Popular Action Party and also material and financial aid to help them fight against COVID-19, to help them keep themselves safe from the coronavirus. And a strike action that was initially planned for today by transporters in the Wuri division did not hold. The strike action has been postponed to a date yet to be announced if the problems presented by the transporters are not solved by the administrative and municipal authorities. The trade unionists of the transporters in the Wuri division decided to suspend that strike action after a late night meeting with the Wuri prefect Mbutu Benjamin and other administrative and top forces of law and order in the littoral region of the country yesterday, and they agreed to suspend the strike action while the administrative authorities find solutions to the plight, notably with regards to the adverse impact of the COVID-19 fight measures taken by the Ministry of Transport on the activities. They are finding it difficult to survive as a result of the restrictions imposed by the Minister of Transport within the framework of the fight against COVID-19. Take a listen to the Senior Divisional Officer of the Uri Division, Mbutu Benjamin.
The strike has been suspended because which the transported we have to continue the discussion. That we say that we cannot have the strike because if the members of this central syndicate, we have decided that we can continue the discussion. The transported ask the reduction of taxes, the reduction of fuel price, and the reduction of local taxes. Because for the local taxes, I tell them we can discuss with the mayors of the town of Douala. We can continue the discussion for the problem concerning the local taxes and other local problems. But the problem like the reduction of other taxes or fuel prices, it cannot depend for me. It depends for the hierarchy of the Yaoundé.
In the report coming up next, Equinoxe takes a look at the fight at the coronavirus pandemic on the African continent.
Advice for Africa is to prepare for the worst and prepare today.
South Africa tops in the African continent by the time of this report Monday, as it records 1,655 cases of the coronavirus. Algeria comes second with 1,320 cases, to be followed third by Egypt with 1,173 cases. Another North African country, Morocco, ranks fourth with 1,113 cases. Cameroon comes fifth with 658 confirmed cases. Tunisia 574, Burkina Faso 345, Ivory Coast, Nigeria, Senegal, Ghana, Niger, Democratic Republic of Congo, Kenya, Guinea and Rwanda have cases between 261 and 101. African nations whose cases are below 100 include Togo, Uganda, Mali, Congo, Ethiopia, Zambia, Gabon, Tanzania, Libya, Guinea-Bissau, Equatorial Guinea, Namibia, Angola, Liberia, and Mozambique. Below 10 cases are Zimbabwe, Chad, Central African Republic, Somalia, Botswana, Mauritania, Sierra Leone, Gambia, Malawi, Burundi, and South Sudan. On the death toll, Algeria ranks first with 152, second by Egypt with 78, Morocco 71. The other nations record death cases between 23 and 1. Nations like Guinea, Guinea-Bissau, Equatorial Guinea, Chad, Central African Republic, Somalia, Namibia, Uganda, Rwanda, Sierra Leone, Malawi, Burundi, and South Sudan have 0 deaths. Meantime, Egypt has 247 recovery cases, far more than others. South Africa 95, Senegal 92, Algeria 90, Morocco 76, with the other countries having below 35. Uganda, Chad, Central African Republic, Sierra Leone, Malawi, Burundi, and South Sudan have 0 recovery. New cases keep emerging rapidly, and the death rates slowly rising in the African continent.
Talking Point is up next. Our guest today is Dr. Njobisie Serge, health policy expert working with the Bopi Baptist Hospital here in Douala as a medical doctor. You're welcome.
Thank you, sir.
You're an expert in health policy. What is your take on the rising figures, the rising COVID-19 figures. Today we are talking about close to 700 confirmed cases as of now. The figures may increase by the end of the day when the Minister of Public Health gives the updates during his daily briefing on coronavirus. As of now, we're talking about over 700 confirmed cases and 9 deaths. What's your take on the rising figures?
Okay, I will start by saying that the figures are alarming, and if you compare the figures we have in Cameroon to other countries in sub-Saharan Africa, you understand that we need to strengthen or to be proactive about the strategies put in place in fighting this infection, or also known as COVID-19. From my own point of view, I think that there's somehow in the measure we put in place a problem along the traceability of contact and the isolation of those contacts. We do remember that a few weeks ago, there were some passengers that just returned from highly infected countries, France, Italy, and somehow they evade surveillance, or should I say confinement. By so doing, they went back to their communities and kept infecting people one after the other. I think that also can somehow explain why today Cameroon is rated the second highest country in sub-Saharan Africa affected by this COVID-19. Another point also is the isolation. What do we do when we find out, or when we test somebody to be positive? Do we have in place some structure to properly isolate these people from those who are not infected? That reminds me of some country like Nigeria. They book stadium, prepare ground for isolation, security, put in place respirators, beds, all the logistics needed to isolate those people so that there will not be transmission of infection from one individual to the other.
And that's why the Cameroon government is acquiring more infrastructures for the isolation of persons with COVID-19, and also for the quarantine of suspected cases. The military stadium in Yaoundé and other structures have been gradually put in place to ensure that the confirmed cases are well isolated, properly isolated. But that seems not to be enough.
Well, first of all, I will applaud that measure, but I think somehow it's coming out a little bit late. We do not have to wait until we have 650 people infected with the virus before we put such measure in place. We all know that COVID-19 started 4 months ago in China. That gave us a lot of time to prepare and put in place mechanism to handle this. As it is now, we hope that implementation of those measures will be effective on ground, because as it is now, that's the only way to combat this infection.
Dr. Ndifo Peter Louis, Secretary General of the Cameroon Medical Council, who was speaking to me in the Inside yesterday, was highlighting the utmost necessity for government to invest more in tracking all suspected cases and all persons who are suspected to have come in contact with persons or confirmed cases. But that seemed to be a quite a difficult exercise. The minister and other authorities have been calling on the people who came through some of the flights coming from infected countries to come and present themselves to health authorities, but many of them are not showing up. Some who have come in contact with confirmed cases are not showing up. Some go to the hospital and they tell lies and they infect even the health workers there. How to go about this, tracking down all those people?
The tracking down of infected people is very important in the fight against COVID-19. As a country, the government has all the means, all the measures to effectively track these individuals wherever they are. We have security apparatus, police, gendarmerie, okay, to go wherever these people are and bring them so that we can properly isolate them and stop the transmission of this disease.
And Dr. Ndifo said that it's no longer an issue of choice. It's no longer an issue of asking you to come or not to come. It should be obligatory, because we're now talking of a danger that is not hitting some individuals but the entire nation as a whole. Those just some few regions have been affected, about 4 regions up to now that have recorded confirmed cases of the COVID-19.
Yes, I share in that line of thought. As I was saying, why don't government just publish out the list of all those passengers? Because these people come from a family. They have neighbors. They know people around. If the list is out, people around are going to ask questions. And we also need to organize some form of mass campaign to educate people more about this COVID-19. Because for us to have almost 700 people infected with the virus, that shows that a lot of work still need to be done on ground. And that is all about information and communication. We should teach people about the signs and symptoms of COVID-19, so that if, for instance, they experience a little fever, headache, and cough, there should be not a numbers from different centers where they can call. From there, they'll be properly oriented on what next to do.
Now, some medical experts, like you explained, that one confirmed case has the potential, or even a suspected case has the potential of infecting at least 10 other persons. And when the figures are multiplied with regards to the number of confirmed cases now, the figures may be much higher than what we have now, the official figures that we have now. Is that true?
Yes, it is very true. Let's go back. Let's go back. 3-4 weeks ago, we had few cases, maybe 5, maybe 2, but today we're talking about 700. That's to tell you that if nothing is done in the next coming 2 or 3 weeks, we are going to be talking about thousands of cases, maybe 10,000. So I think it's time for government to be firm, to come out strong with strong measures in order to prevent the spread of this COVID-19.
Now, Cameroon is in stage 2 of the infection, stage 2 of the pandemic. In medical terms, they're talking about community infection, community transmission among members of the community. What exactly are we referring to?
Well, when it comes to transmission of an infection or illness, there are 4 stages. Stage 1 is when somebody is infected with the virus, has a travel history. Stage 2 is what we call local transmission. Okay, it's when the person that has a travel history and who also is infected comes in contact with family members or people around him, the loved ones, the neighbors. We also have, we have stage 3, which is what is then known as community transmission. Okay, this has to do with a member of a community transmitting the infection to another member, and at this level, the source of the virus is difficult to trace or is almost unknown. And to me, we have gotten to this stage. This is the time for government to take proactive measures, to come out strong. We are not negotiating anymore, because this matter is a matter of public interest, general public interest. We have to protect the majority of Cameroonians. Okay, maybe what I will propose as solution is for government to come out with what we call total confinement. Total confinement. But if before we talk about total confinement, we must understand our economic reality, our context, local context. About 80% of Cameroonians live on daily bread. We can't just ask everybody to be confined totally. Government need to come out with some social relief program. Example, government can offer to pay the electricity bill of Cameroonian, light, the water bill, and why not bring it down maybe the price of fuel from 680 francs to 450. There are some measures government can put in place to help people. By so doing, it will be easier for people to accept total confinement, because you don't expect a man that is married and maybe have 7 children, okay, and who is a breadwinner of that family and live on daily bread to be totally confined. So we invite government to look at ways, okay, to reduce the economic impact of this infection on citizens, so that everybody will now be able to accept the idea of total confinement.
The United Nations Secretary General Antonio Guterres talked about the war economy, the importance for governments to support economies, to support private individuals, to support businesses, to support vulnerable groups of persons. But this is proving a little difficult because of financial constraints. The authorities will talk about financial constraints, considering the fact that, according to what Dr. Samgui said to me in an edition of The Inside, it is quite expensive to take charge to handle cases of COVID-19. How expensive is it?
Well, actually, it is actually very expensive, especially for those who have come down with the stage 3 of the disease. That means those who have come down with severe respiratory distress, because these people need, for instance, to be admitted into a hospital and require respirator.
And respirators are not available in all the hospitals across the country. In a referral hospital like the Limbe hospital, respirators are not there, according to the director of that hospital, Dr. Kinge Nje. And there's a medical doctor who died here in the economic capital of the country, here in Douala, the general hospital, because there was no respirator in the hospitals around.
Well, because there were no respirators available. From our knowledge, in a city of 5 million like Douala, we have about 14 respirators for 5 million individuals. Today, we are being told we have 650
confirmed cases of COVID-19.
Let's imagine a scenario whereby 30 of them come down with severe illness in Douala. What are we going to do? I think it's not yet late. There's still time for government, as I said before, to be proactive, put in strong measures, providing respirators, face masks for the health workers, and whatever it takes to fight this infection.
All right, the Minister of Public Health last week announced that the government was working to acquire more equipment for the hospitals, for the health workers, in order to step up the fight against the COVID-19. Now, let's remind our viewers of some of the basic preventive measures, notably the sanitation rules of the World Health Organization to fight against the COVID-19.
The first one is every Cameroonian should practice hand hygiene. They should regularly wash their hands with clean water and soap regularly. Or for those who do not have the privilege to always have water around themselves, they can use what we call alcohol-based hand rub. Time to time apply it, and
the hand sanitizer.
Hand sanitizer. Okay, it's also known as hand sanitizer. Alcohol-based hand rub.
Concerning water, there's a precision on running water. Where must the water be running?
Water must be running so that as you are washing your hand, in case you have come in contact with the virus, with the running water, with the soap, as you are washing your hand and water is flowing, there is chances for the virus with the soap to slip off and fall out. If you wash inside a container with water, of course, you can still get your hands contaminated. As you are washing off, the virus falls inside the water and you are still washing.
So the water should be running?
It should be running.
Now, the other preventive measures, social distancing.
Yes, everybody should observe at least 1 meter distance from each other. It's important in reducing the transmission of COVID-19 because it has been found that if somebody sneezes or cough, okay, the droplet usually do not go further than 1 meter. So that's the reason why we say we should observe 1 meter distancing.
Right.
Other measures is if eventually you have cough or you are sneezing, make sure you cough into your elbow. Okay, right. You don't cough into the air. You cough in your elbow. That's one.
And the wearing of face mask has become obligatory in the southwest region. Also,
make sure you don't touch your face with your hands so that you don't contaminate yourself through the mouth, the nose, or the eyes. Then, now we are talking about the wearing of face masks, which have become public. I think recent studies have also shown that there are some element of airborne transmission to this COVID-19. That's the reason whereby most people are now coming out to recommend that everybody should wear a face mask to prevent transmission. Then, the position of WHO has not changed as from now. Face masks should be allowed for those who are frontliners in the fight against COVID-19. These people are those who are already infected, those taking care of the infected people, and the health workers. However, government and well-to-do Cameroonians can also encourage local manufacturing of masks. Let it be cloth mask, so that at least people can cover their face. By so doing, we are going to go a long way in reducing the transmission rate of COVID-19 in Cameroon.
And of course, there are other measures that should be respected by all in order to limit the spread of COVID-19 in the Republic of Cameroon. And I want to remind that the President of the Republic of Cameroon, Paul Biya, called on all Cameroonians and all other persons living on the Cameroonian territory to be more responsible and disciplined at this very crucial moment in order to come together, like the Minister of Public Health, Dr. Manauda Malachi, requested, united to fight against this common enemy, the COVID-19. That's it for this edition of the news. Dr. Njubisi Sesh, health policy expert working with the Mopi Baptist Hospital as medical doctor. Thanks for coming.
Thank you.
Thanks for staying with us. Goodbye.